So despite the increased pressure on the NHS, there's some national guidelines that have been laid down.
We've had to adapt our practices and procedures to ensure patient safety.
We know these are very strange times. We are trying our hardest to make everybody feel as comfortable as we can when they are in our department.
We've increased our team over here at Castle Hill so that we can screen the phone calls more, offer reassurance, advice to any patients that have high anxiety or they feel like they're a burden and they don't want to come to the service.
Many procedures are carrying on as normal. It's very important to attend to your procedure.
Whoever has referred you think that you need this appointment so that we can find out what the problem is. Delaying appointments might be detrimental to your health.
So before you attend your appointment, they'll ask you about any symptoms that you might have had in the past and they'll give you some instructions following up to your appointment.
So when you attend hospital now in the pandemic, you'll see some differences.
In terms of the infection control, we do a lot more cleaning in between patients and that's all really important to adhere to so we keep everything as safe as possible.
We've ensured that our waiting area is clean and that we sanitise that area. There is enough space between patients. We adhere to 2 metre spacing with the chairs. We have plastic screens up around our reception area and we do try to minimise the footfall of our staff across the waiting area.
And we encourage you to arrive on time for your appointment rather than arriving early and waiting for a long time in the waiting room.
Try and endeavour the patient gets into the department as quick as possible.
We don't want too many people in any specific area at any given time. Every patient and all the staff maintain social distancing. Everybody has to wear a mask and patients feel that we're quite a scary place to be. But actually we're not, we're still people under the mask, so we've done lots and lots of things to put patients at ease. We will ask you also to wash your hands or to use the alcohol gel as you come into the department.
We wear full protective equipment and that consists of a mask, a facial screen, gloves and a gown. Once
you move into the department, you will be on your own in that room, so the assessment is done alone with a nurse who is also wearing the correct PPE. So we have a lot more cleaning in between patients. We also wash down the surface that they're going to be in touch with every single time, so there's no risk of cross-infection. We understand you might be anxious about coming for your appointment and that is absolutely normal, we understand that.
Give us a phone call, we can reassure you over the phone. We can offer advice from a service perspective, but we can also offer you advice from a clinical perspective.
We're always here to help you.
From patients that have been coming to us, we do ask for feedback and all of these comments have been positive about how they've been supported and put at ease.
It's really important that you attend your appointment to avoid any unnecessary delays in your treatment. Help us to help you by attending your appointment.